everybody. Thank you for inviting me here. So, AI for health. At the heart of AI for health, you have health data, of course. Okay, and we're pretty lucky in France because we have a lot of very beautiful databases. I'm not going to name all of them. That would be crazy. But starting from the databases, some worldwide known hospitals like APHP, and you have like cohorts at INSERMS, and you have a lot of French health companies that have beautiful databases, and many, many, many more. Now there is a dual database I would like to talk about a little bit. Is the SNDS. I don't know if you heard about it. It's the Système National des Données de Santé. It doesn't have any clinical data. Okay, it records all the reimbursements of the healthcares of basically everybody living in France. Okay, and since we are reimbursing at least partially almost everything in France, so we have all the healthcares of everybody in France. So that's more than 65 million people. That's in more than 200 terabytes of data with no images, just reimbursements. It's the biggest, one of the biggest administrative health database in the world. A lot of countries are envying us to have that. It's really a little jewel. It's very rich. You can do a lot of things with it. Let me just name a couple of them. Pharmacovigilance. So it consists in trying to see if one specific medication has a specific adverse effect. So that was, the SNDS was used for the Mediator, for instance. I guess you know about the Mediator. I have a team of 10 people working on SNDS, and we have developed, for instance, on pharmacovigilance, an algorithm which is capable of screening automatically a large number of drugs on the market, let's say like 400, and trying to spot which ones increase the risk of a specific adverse effect. So this is the kind of stuff you can do. You can do many stuff on health. It has a big impact on health, of course, but not only health. You can have big impact on economic of health. Okay? Don't forget that in France, budget of public health is the first budget. Okay? 200 billion euros a year. Okay? So let's imagine you have from SNDS all the healthcare pathways of people being diabetes of type 2, for instance. And if you can do, which is not that easy, but let's say we can do clustering of these pathways, and we can identify typical pathways. If you can do that, then that's jackpot, because you can identify which pathways are the best to cure and which are the cheapest. Okay, so this is enormous. The impact is really, really enormous. So what's the link with the hub? So the Health Data Hub is described in the law Ma Santé 2022 that was voted this summer in July. And basically, the law says two things. The first thing, it says that the Health Data Hub shall be the platform and the unique gateway to this SNDS data for basically everybody who wants to do research for public interest. Okay, so that's one good thing. That's one good goal of the hub. Now, the major thing is the second point, the second thing that the law says. What is the second thing? It says that basically the SNDS is extended. It's no longer just this pretty big database, but SNDS now is extended to all the data that are coming from healthcares that are partially reimbursed by the national solidarity. And since we are reimbursing partially everything in France, basically it means that SNDS is almost every French health data. So the hub is just the unique gateway to all French health data. Okay, so our ambition is really to put at the service of the greatest number all these data with respect, of course, of ethics and rights of the citizen. Okay, so just the gateway to everything, every health data in France. When you put it like that, it sounds like a crazy job to do, right? It sounds like you're never going to do it. But we started to work very hardly since last January. We have a budget of 80 million euros for the first 4 years, which is it's not enormous if you compare it to Batix and GAFA, but it's something, and we will do it. Okay, we are working to do it. So let me tell you a little bit about a few challenges that we are currently dealing with, and that we will be dealing with for a long time, but that we're currently addressing. I'm going to just name 3 of them. The first one, of course, is consolidating massive and heterogeneous data. Heterogeneous because we're going to have images, omics, biological analysis, classical SNDS data, and many more types of data, okay, in a modern infrastructure. Okay, so that's a lot of work, and we should be able to chain all these data together, because the richness of the source of data is really much more powerful if you join with other sources. You know that, I guess. Okay. So the good news is that the infrastructure should be ready by November. Okay, and we'll start putting data on it, but the infrastructure should be ready by November. Second challenge I would like to talk to you about is the fact that, of course, we have to share now this data with all the different actors in a secure environment, and we have to define all the access rules to these things. So that's a big work, trying to define governance rules, okay, and technical work for the secure environment. So that's a good challenge too, and we're working on it. Third challenge is to facilitate cutting-edge research and AI research to startups, big companies, academic groups, hospitals, and many more. So that means we have to provide a modern infrastructure, modern frameworks, modern tools, and so on, okay? If we do these 3 things, and there is a lot of work, and there is a long way to these 3 things, okay? But if we do these 3 things, it's very clear to me, at least, that the impact is going to be worldwide. Everybody will want to come to work on the Health Data Hub. It's going to be really something unique, not only in Europe, but really in the world. And that's really our ambition. And I think I really believe we're going to make it. So now, more specifically, how did we start? How did we start? In January, we said, okay, we need some use cases to understand what are the problems we're going to meet, what are the bottlenecks. Okay, so we made a call for projects. In January, we did very little communication on this call because we were a very small team. We're still very small. Okay. Nevertheless, we had the 189 projects which were submitted. So that was really a lot. We had to select just 10 of them. So I'm very sorry for those who are here who were not selected. It's not that your project wasn't good, but we had to make a selection of 10, okay? Because we're not a big team, so we had to do that. So that's what we did. And I would like to tell you a little bit about, I'm not going to tell you about all the projects, but give you just some insights about what some of them will try to do, because this is research. I'm not sure that they will succeed. And the kind of databases that will be maybe the first databases, apart from the original SNDS, that will be on the hub, ready to be shared. Okay? So we have, for example, a startup who proposed to come with 250,000 annotated mammographies, okay, that they will chain with the classical SNDS. We have another startup which comes with a real-time pacemaker data of 8,000 pacemakers. And the goal here, again, they're going to chain with SNDS in order to understand if people had strokes or not. And the goal is to try to predict the strokes from the pacemaker data. Okay? We're going to have in the hub an almost exhaustive database on sarcoma in France. Okay, a very beautiful database. We're going to have all the data from all the emergency services in France, so that's really huge. We're going to have data from healthcare pathways of more than 20,000 Parkinson and people, and many, many more. Okay, so all these data will be in the hub and ready to be shared, to be accessed for other projects, following the governance rules that we are defining right now, but this and ready also to be chained together or with some other database. So that's very nice. So for those who were not selected, the good news is that there's going to be another call I cannot tell you exactly the official date, but it's going to be soon, and you can get ready and start working on it, okay? Because it's going to be soon. And again, the thing which is important for us, because we're beginning, is like what kind of data are you bringing to the hub? And of course, what is the potential social impact of your project? I have a little less than 2 minutes left, so I would like to finish with one thing. I think which is an important role also of the hub, though it's not written in the law at all, and you'll understand why. We all know that the GAFAs and the Batiks are in France now. Some of them are working really clearly in health. I'm not the kind of person who's going to tell you, it's terrifying, it's really scary, some really bad things are going to happen to us, and so on, we have to react. I think this is good news. This is very, very good news. I deeply believe that. It means that nice things are happening in France. We have very good academic people, we have very good students, we have very nice databases, there are a nice economic setup, economic ecosystem, the startups are fine, so the GAFAs want to come, this is good news. Now, I'm not also the kind of person who's going to tell you, great, the GAFA's here, so we're going to give them the key to the house and they're going to manage everything. That would be totally crazy and not very healthy, I think, for the ecosystem. And I think everybody would agree, even the GAFA, I think, would have to agree that it would not be that healthy. So we have to have a counterpower to the GAFA. This is normal, and this is normal in a regular ecosystem that is healthy. So the counterpower cannot be financial. Just forget it, okay? Because the GAFA, they pay much more than what the government is ready to pay. I'm disappointed by that because I would be very happy if the government could do that, but it's not the case, okay? We're talking about like 10 times more the salary in the GAFA than in academics. So this is not the good counterpower. I think that the good counterpower is on the data, okay? So this is one of the roles of the hub, okay? Gather, or at least being able to gather the data on demand, okay? And then access to everybody, including the GAFAs. We are going to work with the GAFAs and the Batiks, but with our rules. We are fixing our rules of how to access the data. And I think this is extremely important today. And with the GAFAs, with the startups, with the big French companies and worldwide companies, I think this whole project of the Health Data Hub can really have a very, very important impact. Thank you very much.